We are Doctors of the World and we provide healthcare access to migrant populations. So far, what we have been able to do is provide HIV testing for almost 150 migrant population groups across initial accommodations and within the clinic. In addition, we've provided STI testing for 100% of the people that we've seen so far. 98% of the people that we have tested for HIV have never been tested in the UK. Through some of the work that we've been doing, we've managed to support some complex cases, including supporting trans women accessing services, supporting some reproductive health issues, as well as mental health cases.
We are Positive East, working together with Outpatients East at Barking Hospital, the Homerton Hospital, and Barts NHS Trust to develop a wellbeing tool and join multidisciplinary team meetings to better improve the referral rate of people with HIV into support services and fund unmet need. Through this partnership, we have received 350 referrals and provided 1,100 hours of support.
We are Metro and we work in partnership with King's College Hospital and Guy's and St Thomas's. And our aim is to support people living with HIV who are struggling to engage with healthcare, medication. We work in partnership, and that means in developing individually tailored plans, looking to address the very complex needs of the patient, whether it be homelessness, mental health, recreational drug use, alcohol, and the various other things that might impair their ability to engage with healthcare. Our goal is to ensure that 60% of people engaging with this program achieve an undetectable viral load. The last time we measured, 85% of those engaging with mentoring had become undetectable.
I'm here to talk about the GROWS project, which is a collaboration between the Sophia Forum, Positively UK, NAM AIDS Map and UCL. What we've achieved through this Fast Track City initiative is greater partnership working within the sector. We've currently trained 45 women to become peer mentors, delivering support to women ageing with HIV over the age of 40. Through the research that we've analysed and the focus group discussions that we did, we have a greater understanding and insight to the needs of women living with HIV as we age.
We are the VOTE project led by Africa Devox Foundation, working in partnership with Fast Track Cities, Lewisham and Greenwich NHS Trust, aiming at increasing HIV and syphilis testing within homeless shelters and among immigrant communities in London. Since we started the project, we've received reports from staff members we've trained telling us that they are now more confident talking to their clients about HIV, talking about PrEP, talking about U equals U. This wasn't happening before we started the project. We've also seen an increase within the immigrant communities, especially asylum seekers and refugees, accessing our services. As we're speaking today, there is more understanding about HIV, there's more access, and there's more engagement.
We are GMI Partnership and we have a mobile HIV testing clinic that we take out into the streets providing HIV tests to marginalised communities. Over the past year we've provided 1,789 tests. 40% of these people have never tested for HIV before, so without this project they would never know their HIV status.
We are the Stay and Play project. We run groups for young parents living with HIV. Since being part of the Fast Track Improvement Partnership, the Stay and Play has connected with other wider community members and other group members. Since 2020, we have supported 37 parents and 28 children who have accessed health and well-being information, networking with other parents who are in a similar situation, and also receiving one-to-one consultations with clinicians. That means that the quality of services we provide has improved, and also we get more referrals into Stay and Play from different boroughs and different community organisations.
We're Living Well, and we provide a service called Connect Well, offering a range of online, one-to-one and group services for people living with HIV across London who are suffering from loneliness and isolation. Over the last 2 years, we've helped over 600 people from across London. Of the 600, 500 have accessed group services and over 300 one-to-one services, including counselling, life coaching and hypnotherapy, all helping them to deal with issues around loneliness and isolation and better health and well-being.
I lead on the video creation aspect of the Positive Champions project, which is a collaboration between NAM AIDS Map and African Advocacy Foundation to encourage people from Black communities to test for HIV. Since working on this project as part of the Improvement Collaborative, we've seen enormous change. We've done thousands of HIV tests with people from Black communities, and crucially, 5 of those tests have come back as positive. Yet those people who've tested positive have now started treatment and can live a normal life with HIV. Also, we've made 25 videos that have been seen by over 100,000 people, encouraging people from Black communities to test for HIV.
We are Change, Grow, Live. We're the largest drug and alcohol service in the UK. We're working across 9 boroughs in London with NHS trusts. We're working to support individuals within our service who are also living with HIV. To date, we've supported over 1,000 individuals. We've seen an increase of status recorded at assessment up to 95%. And we've trained over 1,000 professionals in GP surgeries, mental health services and sexual health services in chemsex and HIV.
The FaithWorks project aims at faith leaders to engage them in meaningful dialogue about HIV and sexual health issues and to reduce stigma among people living with HIV. The FaithWorks project has worked tremendously. We have reached over 3,000 people or congregants from various sects, Catholic, Muslim, even people from Protestant backgrounds. We have reached over 100 faith leaders. We have also offered HIV testing to over 100 people. Among those, we've identified 3 positives, 2 who are newly diagnosed and 1 repeat taster.
We are a peer support project working with the Chelsea and Westminster Hospital, with Positive UK, NAS and Plus Health. What makes it unique is that we get to engage with patients who are newly diagnosed. Having somebody there in those first few weeks is what's very important. We work hand in hand with the clinicians and pharmacists as soon as a person is diagnosed. So this basically gives us a continuity with their overall holistic care. Before COVID, we had 1 person a month being referred into our service. Now we have over 9 people a month on average being referred into our services.
Positively UK is running welfare advice service as part of the Fast Track Cities Improvement Collaboration. So far we've seen 484 individuals and supported them successfully to claim over £1.1 million of entitled benefits. We work and get referrals from 17 HIV clinics across London, as well as our voluntary sector partners. We've organized 12 workshops on issues such as universal credit, PIP, household and debt management. And we are proud to say that all 484 people that we've seen are currently engaged and retained in care.
In the 20 years that I've worked in HIV support, I've never seen a better example of collaborative working and solution-focused working.